Hiya, my name is Emma Riley. I am the Healthcare Services Director at RAS Healthcare. I'm also a oral health educator. I thought I'd share with you some guidance that we've written for some care homes involved in a project that we're doing up north. You can probably tell by my accent where I live. It's a project that's taking place in Rochdale, Oldham and Wigan, and we've written these guidelines in conjunction with infection prevention on how to manage the oral care for COVID positive or suspected residents within care homes. There isn't much out there. There are guidelines for hospital residents. I'm sure there's some out there that's being made at the moment for residents in care homes, but we just wanted to give you something tangible that you could maybe, pardon the pun, get your teeth into or pick things that might be relevant. So have a look at this video, see what you get from it. At the end there's some links for further information on products that can be prescribed, products that can be purchased, training videos if you're interested in some training. But please just see what you think and give us some feedback. The project have been going really well, and the feedback that we've had from our staff, the carers, who by the way have been phenomenal through this time, as I'm sure you all have been, is that some of the residents' mouths have been a little bit dry and the mouths have been a little bit coated. So we'll go through this in this brief video and give you tips on how to manage that. While I've got you, and it's quite important, we've also had some feedback that some of the carers' mouths have been affected during this time. They've noticed the mouths have been a little bit dry. Some of them noticed little cracks at the corners of the lips. It's really important that you don't ignore this. The mouth mirrors your general health, so we can tell a lot about a person by the state of the mouth, the oral mucosa, the skin inside the mouth. It could be that you're run down a little bit, which might be because you're all busy, dehydrated. Also, it could be the PPE. Wearing the PPE for long periods of time, I know myself, your mouth does get dry. So please don't ignore it. There are things that can be prescribed for that. Again, link at the end. But in the meantime, if you are using lozenges or chewing gum, please make sure it's sugar-free. All right, so let's crack on. It's not long, this video. I'm going to refer to the guidelines. If you want them, please let us know, contact us, and we'll send them to you. We're here to give you as much information as we can. Before you're delivering your oral care, obviously you have to look at your PPE and hand washing guidelines, which I'm sure you're all doing in your sleep at the moment. So that's really important. As far as oral care goes, it's getting everything ready. And you're going to say to me, well, what do I need to get ready? It's on a toothbrush, like that. I need you to preempt and get everything ready, which is really important that you need a buddy or a colleague who's in there with you, who can help with this. We have advised in our guidelines that the denture that the toothbrush and denture brush is renewed every 7 days. Again, that's up to you what you do with that, but that's what we've got our homes doing. We've also asked that they write the name on the toothbrush and the date, if possible, with an indelible pen, and the same with the denture brush. All right, again, that's entirely up to you if you want to do that. If your resident uses an electric toothbrush, it is really important during this time that they go back to a manual toothbrush, because reducing the spray that comes off from an electric toothbrush. Okay, so please get a normal manual toothbrush. So you've got your buddy, you're going to ask your buddy to get everything ready, and they're available for use. Now, normally we assess the resident's mouth before we do anything. That's what you should do anyway. You assess it, have a look in. Sometimes the lips can be that dry that even just going in could crack them. So in some cases, I ask my buddy to get a little bit of the gel and pop a little bit on the back of my hand. Okay, now not for everybody, so that I can apply it to the lips first before then I have a look in and assess the mouth. All right, it's really important. A lot of time people go in and they're pulling the lips around, and if they are dry, they're cracked. You know yourself, if you've had a crack on your lip and somebody keeps pulling it, it's really sore. So sometimes getting your buddy to decant a little bit on the back of the hand. All right, but I'll come back to that shortly. Have a look, see if everything's okay in there, then we can proceed. If you notice anything's not all right in there, now I'm not expecting you to be a qualified dentist or whatever, but if something doesn't look quite right in there, please make a note. And I must stress that goes for any resident. So if you were bathing them and you noticed something wasn't quite right in the skin, they had a mole that was growing or something didn't look right, you would make a note of it. The same applies with every resident that you care for. All right, so if you're happy to proceed, you've got your gels, you've got your gel and you've got your paste. Now then, the gels are available on prescription. Again, there'll be a link at the end. You've got your paste and you've got your gel and you've got your toothpaste. Now then, it is really, really important that we're using a non-foaming toothpaste. Public Health England have written guidelines for oral care in for patients in hospitals for providing oral care, and they have advised a foam-free toothpaste. So a foam-free toothpaste is something that does not contain sodium lauryl sulfate, SLS. Well, sodium lauryl sulfate, without trying to bore you, is something that's in DAS, fairy liquid. It is a foaming agent. Now, I use a foaming toothpaste. I like a foaming toothpaste, but when you're brushing somebody else's teeth, it's really difficult to see what you're doing. So a foam-free toothpaste is really makes it easier. Plus the fact, if you've got somebody with COVID and I'm wanting to cut down any spray or any mess, I want you to use foam-free toothpaste. All right, link at the end. All right, so let's start. So I've got my buddy to open up a little bit of the gel and put a pea-size amount on the back of my hand, and then close the lids back off. Same goes with the toothpaste. I always put a little bit on the back of my hand. Do you remember the days when you used to put it on the toothbrush and by the time you got to the patient it was on the floor or down the top? Don't do that. Pop it on the back of your hand. Okay? All right? Follow me up to now. You're now ready to proceed. So you get a little bit of the gel on your finger and start applying it around the mouth. Now, you're going to say to me, Emma, there's some residents I can't get in to do that. I understand that. And I'm not, that's a whole different video. Again, I sound like somebody from a QVC channel. If you're interested in further purchasing of our videos, there's no purchasing by the way, even. At the end of this, there is a link to a video for providing oral care for dementia patients. So again, if you're interested, contact us and we can do some training on that. All right. So right the way around the mouth, you're then ready to brush their teeth if they've got teeth. So I've got my toothbrush. Now, I use a toothbrush, if you can see that is a small headed toothbrush, a baby toothbrush on a long handle. Again, links for these are at the end. This was actually designed by speech and language therapists. So it means I can get it in easier. I don't want a massive big toothbrush. It's harder to get in then. I don't need to wet this because it's a foam-free toothpaste. I can wet my brush if I want. I could get my buddy to wet the brush if I wanted to. Into there and start brushing. Now, I split the mouth into 4, so I do 4 quadrants so I know where I'm up to. Do as much as you can. Try and get in there. If they've not got teeth, it's still important to remove any residue in there, any biofilms, that's the sticky stuff that occurs in your mouth, with a toothbrush. If they've had a denture in there you've used a fixative in, sometimes when you take the denture out, they've got some of the fixative still present on the palate or on the lower. That needs removing as well. All right, so as best as you can, brush. Now then, you don't need to spit out because there's nothing to spit out because I've used a non-foaming toothpaste. But if they do, and there is a little bit of residue in there, get a wipe and just remove it. I should stress, you've got to try as much as you can to brush the tongue because a lot of the bacteria and debris will build up on the tongue. Try your best to do that, but just be mindful, try not to make them gag too much. It can be quite nasty, a few minutes doing that on somebody. All right, now you've done that, you want to still then apply more gel. If you need your buddy to give you some more gel because you've used up what's on the back of your hand, get them to decant a little bit on a tissue because it's dirty now. I don't want that tube touching that. A little bit on a Conti wipe, and then you can apply some more. I always take it off there and put it on the back of my hand again, and then I can go in. All right. Now then, when cleaning dentures, actually, do you know what? In every training we do, dentures is probably the one thing that people ask most questions about. If they are full or partial, please fill the sink. I know it sounds mad, but people do clean over an empty sink, and if they drop them, they will smash. Fill it with water, and then get your denture brush under the water with your denture under the water and give it a really, really good scrub. We're wanting to do that because the biofilms that live in your mouth stick to your denture. So it is really, really important that we mechanically get rid of those. I just use liquid soap on my residents' dentures and give it a good scrub. Then I rinse it. Now then, the bit that we've put in our guidelines is then to soak in chlorhexidine mouthwash for 10 minutes. Corsadil, you might know it as. Now again, this is up to your infection prevention teams wherever you work. Our infection prevention team thought it was a good idea. There's very little evidence around with anything to do with COVID at the moment, but it wouldn't do any harm. So we we soak, in a denture pot. Now then, I've got a colleague who has got a massive big bugbear with denture pots, because what we sometimes see them doing is just emptying it, filling it with water and putting the denture in. If I showed you under a microscope what was in here, you wouldn't never do it again. The biofilms stick to the inside of here, so it is no point in you spending ages cleaning that denture and then popping it into a pot that you've just rinsed and popped. That needs a really, really good clean as well. So you need to get your hands in there and give it a good clean. Soak the denture in there for 10 minutes, then you take it out, give it a good rinse again. Now if it's during the day, if this is a morning, if you're doing the teeth in the morning, place it back in the mouth. If it's at night, then clean water, fresh water, leave it in water overnight. Now the toothbrush needs to be cleaned under warm water. Yeah, we have then advised them to soak again the toothbrush in the chlorhexidine, the Corsadil mouthwash as well. Now then, once that's been done for 10 minutes, you remove the toothbrush, tap, remove any excess and let it air dry. Now then, again, the public health guidelines for hospitals said it needs to be placed in a container or in their wash bag. We've got some containers here with air holes. This is perfect. Bob them in that. If anybody's interested in these, follow the link at the end of the video. And that's perfect then. So basically you're leaving it breathable storage case. Okay. These need to be cleaned as well. So there's no point in me keep putting that toothbrush in there if I'm not cleaning that as well. So as far as these two go, please make sure you're cleaning those thoroughly as well. Whoopsie daisy. When all the care is being done, you're happy with everything, the lips look lubricated, make a note. Now then, oral care should be provided last thing before night and then any other time during the day the same as far as teeth goes. All right, so if they've got teeth, last thing before bed and then any other time during the day. The gels need to be applied as often as necessary. So if you've got somebody who's got a dry mouth, that might need reapplying every 4 hours, every 3 hours. I'm not going to tell you these are going to last every 4 hours. It might say they might get through the night with a bit of gel. Please look at your resident and see how often they need it applying. For end of life, and unfortunately you will see people who are end of life, they might need this applying regularly, maybe every hour. The one thing I will say is if you're applying these gels, please make sure that you remove any residue in the mouth before reapplying. So again, you're going to need your buddy in to decant and do the same that you were doing before. Now there are some links. We will send a link for the Mouth Care Matters on looking after denture care. We'll put some links at the end, as I've said. Please give us a bit of feedback. As I say, these are just guidelines that we've produced for our homes, and the feedback we've had has been pretty good. If you're interested in any Zoom training with ourselves, which is CPD accredited, please let us know. Please follow the link. But more importantly, go for it with oral care. It is so important for the resident, for the family, everybody. But more importantly, please stay safe and take care. Bye bye for now.